Gonzalez, Deputy Director General at the World Trade Organization. And I am very pleased to welcome you to this panel on the trade facilitation at the crossroads. Is the pandemic changing the way we cut red tape? We know that the speed and scale of the COVID-19 pandemic has brought to the forefront numerous frictions along healthcare supply chains, including the distribution of personal protective equipment, vaccines, and ancillary equipment. While political will is, of course, a key barrier to the equitable access to medical supplies, cumbersome trade procedures also hinder their timely distribution. Over the last year, numerous stakeholders coalitions have emerged to support the successful and equitable distribution of medical supplies. This includes the COVID-19 Vaccine Global Access Facility, better known as COVAX facility, and trade facilitation efforts led by the Global Alliance for Trade Facilitation, which recently launched projects to support the import of vaccines in collaboration with UNICEF and rapid test kits for HIV/AIDS and malaria into Mozambique. In this session, we bring together representatives of public-private coalitions to share success stories and lessons learned to strengthen healthcare supply chains beyond COVID-19. So we will discuss important topics such as how can trade strengthen resilience and recovery, what is the role of trade facilitation in enabling equitable trade, and how can we keep trade flowing while protecting populations. And we have a fantastic panel to join us in the conversation. Let me introduce them before we get off to our questions. So we first have Charlotte Petri-Gordnitska. She is the Deputy Executive Director of Partnerships at UNICEF. Ms. Gordnitska, who served as the Chair of the Development Assistance Committee at the Organization for Economic Cooperation and Development prior to this appointment, brings to the position 20 years of experience in international development, and she has successfully implemented and built innovative partnerships with leaders from civil society, national governments, and the private sector to deliver program results and influence critical policy changes. We also have with us Philip Isler, who's the director of the Global Alliance for Trade Facilitation, which is based at the World Economic Forum here in Geneva, Switzerland. The Alliance aims at incubating and delivering trade facilitation projects from the bottom up by leveraging on funding and expertise from both donor countries and private sector companies working jointly. Philip has been leading trade facilitation initiatives for the past 15 years in many parts of the world. We also have with us Henadi Al-Saleh, a chairperson at the board of Agility. Henadi is the chairperson of Agility's board of directors and leads digital transformation across Agility and its subsidiaries. She oversees the company's corporate governance programs while safeguarding the interests of investors and stakeholders. She also leads the company's technology venture team, which partners with startups and entrepreneurs that are reshaping the supply chain. And as part of this portfolio, she also oversees SHIPA, which is Agility's innovation arm. And last but not least, we have Kajenje Kakombe, chairperson of KEPSA Health Sector Board. He is the CEO and managing director of Metropolitan Hospital Holdings Limited. He's also a director at MedSource Group Limited, a founding member and past vice chair of Kenya Healthcare Federation, the first healthcare governor in KEPSA, a past member of the National Economic and Social Council, and chairman of Kenya Association of Hospitals. So a fantastic panel coming from many different walks of life. So let me start with you, Charlotte, and ask you, how has the pandemic affected UNICEF operations, and how has the organization adapted its approach? And in particular, I would like to hear from you, what is the importance in your perspective of taking a multi-stakeholder approach to tackling challenges during and beyond the pandemic? Charlotte, over to you.
Thank you very much for the opportunity. So, well, first of all, when the pandemic hit, we didn't see how it's affected children the most, because we saw a lot of consequences for the elderly, but not immediately for children, but for children and women and people in poverty, we soon realized, as we always do in crisis, is that, you know, the inequalities did increase, and already marginalized groups was disproportionately impacted and still are. So the work that we do for children had to continue and even increase in a very difficult time to do so. And like many other organizations and businesses, we also faced unprecedented challenges in delivering our life-saving supplies for the COVID-19 response, and also other humanitarian and development programs, particularly at the onset of the outbreak. Our operations were affected by significant market constraints, pricing volatility, export-import bans, very limited options for air and sea flights, and limited handling capacity at air and seaports from origin to destinations. And this was a huge constraint, particularly with PPEs at the onset of the pandemic. There was also an unprecedented increase in the demand of essential supplies, with limited availability in the market, for example, for the vaccines themselves, cold chain equipment, oxygen equipment, and PPE. COVID-19 vaccine rollout, multiple unknowns, including those deriving from global transport disruptions, and the fact that many of the supplies were new, and we needed to register them in every destination country and ensure roles for liabilities and accountability were clear. Critical time and product safety requirements, need for pre-positioning of auxiliary equipment, among others. So there was a lot of new challenges in the way we operated. And very important as well, country unreadiness. The ultra cold chain requirements of some of the vaccines, for example, have been very challenging to many, as very few countries in the world previously had this capacity for this type of requirement. But what did we do? Well, at the onset of the pandemic, we took immediate steps to mitigate the impact on children and families by pre-positioning supplies in regional hubs, and we encouraged local procurement of COVID-19 commodities such as PPE where it was possible. And we already had pre-existing arrangements with our freight and forward carriers, which helped ensure that the programs were less impacted by the pandemic. But what we also did, which I think we have learned and in the middle of all challenges been very inspired by, is that we took further steps together with others. The World Economic Forum, together with World Economic Forum and 18 shipping, airlines, and logistics industry CEOs, we signed an industry charter committing to support the inclusive and safe distribution of COVID-19 vaccines. And the airlines readied themselves and were willing to prioritize vaccine shipments, and some carriers prioritized COVAX C shipments, including of syringes and safety boxes and so on. And also towards the end of last year, we established a partnership with IATA, and with them convened the airline industry to brief them on COVAX and our need for fast and efficient operations to distribute vaccines and supplies. And we established the Humanitarian Air Freight Initiative with major airlines who committed to offering the highest priority for space to COVAX shipments through a dedicated solution for vaccines. So there are many examples of partnership, but I think it is important to say that without a multi-stakeholder partnership during the COVID-19, we wouldn't have been able to say today, which we can, that we have delivered 300 million doses of vaccines to low and middle income countries. And through what you know as the COVAX facility led by Gavi, the Vaccine Alliance, WHO, and CEPI, UNICEF is working with manufacturers and partners on the procurement of COVID-19 vaccine doses and human immunization supplies, as well as freight, logistics, and storage. And thanks to the initiatives that I mentioned, everything from the World Economic Charter to COVAX, our high-profile engagement with industry and other stakeholders, the collaboration has contributed to a more prepared system with many actors going above and beyond their normal businesses. But more critical moving forward globally is public-private collaboration to build efficient systems allowing for more expedited procurement for transport and delivery of essential supplies to those most in need. We need to learn from what we had to learn during this pandemic. Supply chain blockages of critical humanitarian supplies can be prevented. We can learn from the gaps and bottlenecks resulting from the pandemic's impact on the global and national supply chains and use this alignment among many of us to help build more resilient supply chains. For example, the Global Alliance for Trade Facilitation and UNICEF, we are working together since July last year on vaccine clearance issues and possible solutions, aiming to support select UNICEF program countries to improve systems that will ensure a faster importation and clearance of health products, vaccines, and other commodities. A pilot initiative was already launched in Mozambique in June this year in collaboration with the government and partners to digitize import and clearances processes. And similar bottlenecks assessment and multi-stakeholder engagement is currently underway in Botswana. So there are examples, pilots, and good learnings to build on, but we need to do that to build a systematic way of working going forward. Thank you for the opportunity.
Thank you. Thank you very much, Charlotte, for those insights. Philip, let me now turn it over to you and ask you, how is it that the pandemic has affected the Global Alliance for Trade Facilitation and your work? And in particular, what is the Alliance doing in terms of strengthening essential supply chains like healthcare and in agriculture? And based on your experience, how can trade facilitation reforms like paperless trade implemented during the pandemic strengthen supply chains in the longer term? Over to you, Philip, please.
Thanks very much, Annabelle, and thanks, Charlotte, because I think our worlds work in parallel, and a lot of what Charlotte has mentioned, I can see within our own organization. Perhaps to start off with, the Global Alliance for Trade Facilitation is a public-private partnership funded by 4 donor countries. But with the particularity is that we incorporate over 30 multinational companies from the private sector and over 250 local companies and SMEs around the world. And what we do is we identify blockages in the supply chain and try and formulate, finance, and deliver practical and pragmatic ways of overcoming these blockages. So, that is our DNA. And in terms of the pandemic, how did we deal with the situation? I think we can probably break down the whole experience we've all lived in 3 phases. The first phase was the first 2 or 3 months of the pandemic. Our worlds were turned upside down, and of course, that was the case with supply chains. And I think within the technical assistance community, everybody came together to try and overcome some of the immediate challenges, getting support equipment into countries. And what we did was really focus in about the 30 countries in which we work and try and do anything we can to try and help them in a practical way. You have to note that our area of intervention is very focused on border crossing. So we do not get involved in getting the supplies, which obviously was a big challenge, or the internal distribution, which I know it was also a challenge. Really, we're focusing on trying to get the goods out of the ports and the airports to be able to get the support equipment as quickly as possible. So, we had to review a number of simplify processes in our partner countries to try and accelerate the getting of the support equipment out. So that was the first phase. And then the second phase we could categorize as being a consolidation phase, because of course we had been working on a number of projects, about 25 projects in different parts of the world, and we needed to make sure that all that effort was not thrown away with the arrival of the pandemic. And as we know, when the pandemic started, nobody knew what we were facing and how long this would last. And interestingly, what we found is that very quickly, countries we're working in refocused on the work that we had been doing so far, because they realized how important that was. But the biggest realization, of course, was that of digitalization. It became very clear that in the case of a crisis such as what we faced, having manual processes is not always the best way. And if you are able to digitalize, you can be more resilient. And in a way, if there's a silver lining around this, it might be that a lot of governments not only recognized the usefulness of digitalization, but actually this created impetus and momentum to actually do something about it. We're doing some work on things like digitalizing phytosanitary certificates. Well, there was clear evidence that in countries that had already established this digitalization or this automation of phytosanitary certificates, found it easier to navigate through the pandemic than those who hadn't. So this was the consolidation phase. And in that phase, I would also incorporate the arrival of the vaccine. And here too, what we did, we worked with our partner countries to see what we could do just to make sure that, the vaccine got through the borders as quickly as possible. And, I think we were reasonably pleasantly surprised in the sense that, yes, there were major issues with regards to supply, issues with regards to delivery to the end patient, but the actual crossing of the borders was not as difficult as we had initially expected. Nevertheless, what we did is work with a number of countries, especially in the ASEAN region, just to make sure that there were no procedures or processes that were hindering the clearance of the vaccine. So I hope we played our role in that sense. And then the third phase is the phase we are in now, which is all about learnings, right? So what have we learned from this experience, and what are we going to do to make sure the next time a crisis happens, which it will, we are better prepared as a community? And here again, bringing digitalization but it's not, maybe make the difference here between digitization and digitalization, right? It's not just the fact of converting manual data into a computer system, but it's everything that comes around to make sure that it operates correctly. And then the other aspect is, is there a way of helping countries establish some processes to prepare themselves for the next crisis? And here we're doing some work with Columbia University and other partners to see what can be done. With regards to healthcare and the distribution or the movement of healthcare products around the world, as Charlotte mentioned, we've been working very closely with UNICEF. We have a channel or a work stream, shall we say, within the Alliance, which we call business action projects. And what we do here is we work with the private sector and with international organizations in a very practical way to identify where blockages are found. And when blockages are identified, we are notified of those, and then we go in, diagnose the situation, and if we feel that the environment is conducive for reform, we will then formulate a project, finance it, and implement it. And in this case, what was interesting is with the arrival of the COVID vaccine, we had to be careful that other vaccine distributions around the world were not impacted. I mean, other diseases are out there. And so what we found is, we focused mainly on the African continent, and what we found was that a lot of types of healthcare products, such as it started off with HIV test kits, were being blocked at ports and harbors, and we didn't know why. And so we were working with specifically an American healthcare company who notified us of this problem. And we chose Mozambique, not because that was where the major issue was, but mainly because we felt that was where the environment was most conducive to do something about it. And then if successful, then replicate this in other countries. And what we found, again, is that a lot of the difficulties were due to the fact that there was one process which was manual. And this single manual process was effectively holding up the clearance of the goods. So we then started discussion with the authorities and say, look, can we help you automate that process connected to the single window? And that's what we are doing at the moment. And that is, it's a very practical approach. And what we feel is that, taking these steps one at a time, we can start making a difference and then scale up. And in that sense, it's great to be able to operate with UNICEF and other partners. So I'll leave it there for the time being, Annabelle.
Thank you very much, Philip. Very, very practical work and very impactful, I have to say. And this also resonates very much with the work that we're doing here at the WTO, where we have put together an indicative list of trade-related bottlenecks and trade facilitation measures on critical products to combat COVID-19. And we have compiled these measures in conversation with leading manufacturers, and some of the issues that you were mentioning resonate very much. And maybe just put a plug here to say that we're coming up with the revision of this document next week, and I would like to invite all of you to check it out, because there are the bottlenecks are identified, but then some of these good trade facilitation measures that Philip was referring to are also identified in the paper. So let me now move to the perspective of the private sector and bring Henari in and ask you, how has the pandemic affected your global operations, and how have you adapted your approach? And also, given the impact of the pandemic and looking ahead, what have been your key takeaways for any organization, be it public or private, and how do you think they could work together better? Henari, please.
Thank you. First, a thank you to the WTO, the Global Alliance for Trade Facilitation, and the WEF for this opportunity. It's such an important discussion and an evolving discussion, which is personally, I think, far from over. The pandemic is probably one of the most serious challenges we face at Agility for all our stakeholders and the communities we operate in. And it's touched every single aspect of our operations. The supply chain disruption and upheaval over the past 2 years is unprecedented and persists and continues to threaten the global economy. But let me jump into how we at Agility address this issue. We focused on 4 critical categories. The first was keeping our employees safe. The second, keep cargo moving. We had to ensure the continuity remains for our customers and the economies they serve. Third is we had to give back. Where we can contribute supply chain support and life science expertise support, we did. And fourthly, collaborate with private and public sector partners to move fast, be creative and innovative to solve problems at hand. So going into how we kept people safe, we have hundreds of offices around the world and over 25,000 employees. We had to move quickly to allow employees to work safely from home. It was early in March when we actually started setting up global rapid response teams, BCPs, putting them in place. And we also had to put in place critical office safety guidelines. 42% of our employees were fully operational. They were related to the warehousing and distribution and logistics in order to ensure cargo kept on moving. As you're all aware, logistics early on was designated as an essential industry. As for the rest, around 58% of our workforce had to work from home. Global IT and digitization was essential, and we had to roll out 8,000 plus VPNs all around the world to enable us to continue working. Secondly, we had to focus on keeping cargo moving. We became the supply chain industry source for accurate, timely, and comprehensive information. Information was critical and visibility was critical. We built a reporting database and a system for our global network to feed and get information for live updates. It was a comprehensive COVID-19 website at the country level, providing information on country lockdowns, air, ocean, road capacity, COVID health and regulatory requirements, cross-border restrictions, and so on. But also, we had to support our freight customers. We had to give them the visibility of their orders, ensure that they had the right pipeline in place, locate storage space, find capacity by shifting modes, ensuring that their goods reach the destination at hand. Thirdly, in terms of giving back, we had to contribute our expertise. Let me just give you a few examples of what we did. We set up an air bridge so COVID tests done in Spain and other parts in Europe could be analyzed in the UAE in under 24 hours. We moved emergency PPE from China to frontline healthcare workers in different parts of the world, such as Ireland, Sweden, Turkey, and so on. We moved COVID therapeutics from Japan to Hungary, ensured we moved goods such as disinfectants and PPE to refugees in London and hospitals in Mozambique. But also we gave strategic assistance to different governments within the Gulf area. The governments and health authorities turned to us early on in the pandemic for our expertise. We supported them in establishing and managing emergency food stocks, centralized storage for national COVID fighting medical supplies, and also handles transport and supply chain logistics for government quarantine facilities. And lastly, and just as important, we focused on collaborating and moving fast and innovate to find answers. We're a member of two groups that have done amazing work to prepare the world for distribution of COVID vaccines. One group is a World Economic Forum's Industry Action Group for Supply Chain and Transport, which without its work, there would have been no organized systematic approach to the vaccine rollout. The second group, which we participated in, is the Hope Consortium. It's an initiative by the government of Abu Dhabi to turn the UAE into the world's global vaccine distribution hub. And with that, we managed the shipments of more than 12 million doses of COVID-19 vaccine from Beijing to Abu Dhabi, and thereafter millions more from Abu Dhabi to Algeria and Egypt. So those are our 4 concentration points, which we support and will continue to support.
Thank you. Thank you very much, Hinari. Very, very interesting experience as well. And let me just, before going to Kaninje, ask our audience to please get ready and start sending your questions, because we also would like to hear from you and have our great panelists address your areas of interest. So Kaninje, let me now turn over to you and ask you from a local private sector perspective, how has the pandemic affected your operations and how have you adapted your approach? What are the key trade-related barriers that you have seen to achieve access to quality healthcare in Kenya? And how can this be overcome? And how can we keep trade flowing while protecting populations? Over to you, please.
Thank you, and thank you for this opportunity. Like many countries, Kenya's first response was keep the pandemic out, close the borders. But it soon became apparent that that option was not going to work. The second response was, this is a government problem. So the government will handle it, it will do the management, it will isolate and quarantine people. And that soon clearly became untenable because the facilities weren't adequate. In the meantime, the private sector had to reckon with a number of challenges. And the first is that the economy, essentially the country was shut down, and PPEs were very, very difficult to get. So the private sector under KEPSA, which brings about 500,000 businesses together to engage with government, basically formed a partnership with the government to work on a whole of country response, so that instead of a government response or a private sector response, Kenya adopted a whole of country response where everyone, the private sector, the government, the NGOs, the donors, everyone was in the same space, doing the planning, looking at solutions, looking at who had capacity. Specifically for the private sector, our first challenge was to get PPEs. And Kenyan manufacturers were approached and they began to make the very essential ones like masks and sanitizers. That was in the first phase. The second challenge was testing. Test kits were not available. equipment was scarce, so the private sector became a major player in the testing space, and we are still very, very key in the testing space, whether it is PCR or rapid tests. I think we do more tests than the government does. And the third was to become a major provider by installing oxygen plants, scaling up ICU capacity, building isolation centers. We could respond faster than government. So there are more beds in private facilities today for ICU care, for example, than we have in the public sector. Among the key challenges we faced, the first one was nationalism. Every country began to look after its citizens. So if you don't make vaccines, then you basically have to wait until others have vaccinated their population. If you don't have PCR equipment, you can't get it from the US. If you do not have test kits, you have to wait. So for those things that we could make locally, we made locally. For the ones that we couldn't, apart from the country shutdown, there was also the problem of local approval, where our regulators say they have to go through a process of approval in emergency conditions. So one of the things we've asked for, and we hope it becomes a global practice, is reciprocal recognition of products, drugs, so that we don't have to go through lengthy processes of approving test kits when they have been tested elsewhere by reputable organizations and they are working. So at the moment, we are focusing on the not post-pandemic, how to live with the pandemic and still continue to build the country. And Philip took words out of my mouth about digital, using technology as a foundation for everything we are doing, whether it's vaccination certificates, managing vaccination across the country, tracking products from factory to the hospital, making payments for services and products, and even communication like we are doing on Zoom, because, and I think Philip was talking about Kenya when he talked about countries that have gone digital. If COVID had struck Kenya before M-Pesa, before we digitized our tax authority, the country would probably have ground to a halt. But we've been able to continue paying, continue communication, continue working from home, continue to import and pay for products if shipping is available. So there is quite a bit. And among the changes that did happen was, for example, our airline repurposing aircraft from passenger to cargo, the government organizing aggregators for products because shipping became a major problem. So in a nutshell, the greatest impact has been to drive a digital economy, whether right from communication all the way to payments, surveillance, and intelligence for making sure that we are focusing our efforts where they'll bear the greatest fruit.
Thank you very much for your comments as well. So I think a lot of very interesting things have been said, which again resonate very much with what we see here in the WTO in terms of, for instance, the bottlenecks impacting the cross-border movement, for instance, of vaccine inputs. These differences in regulatory approvals that you were just mentioning, Dr. Gakombe. We've seen this in terms of, at the inspection level, but also at the release, and even different regulatory approvals impacting donations that countries are receiving. We've also seen bottlenecks related to the distribution of the finished vaccines and immunization supplies. So this work that is being done by all of you in very different ways from this perspective of public-private collaboration is very critical in terms of sorting out problems on the ground. Let me now invite all of our audience to see whether there's any particular question you would like to pose to our speakers. And I think we have here, I have one here that basically says, how did the trade facilitation help countries acceding to the WTO? That is, we're not part of this platform of the WTO, and how can resilience programs work for them, and can pandemic affect more their acceding process and integration to the global economy? So this is from someone who comes from a country that is in the process of accession to the WTO. Maybe you would also want to tackle it from the perspective on the ground, in terms of what is it, for instance, Charlotte, that you have seen on the ground, or Philip, you may also want to come in. How does having access to global rules benefit countries in terms of trying to facilitate and speed up these measures at the country level? So Charlotte, maybe you would like to come in.
Thank you for the opportunity. The short answer is that we are striving for localization as much as possible. It's easier said than done, but it's the guiding principle. UNICEF is so why do we deliver vaccines for COVID-19? We are an agency focusing on children. We do it because children need vaccine for measles and polio. So every year we distribute 2 billion vaccines to children. So that's the experience around which we build what we're doing now for COVID-19. And when we have worked with the routine vaccinations over time, we have tried to really not ship things from one coast to another, but to really build sustainable markets closer to people. And there are 190 UNICEF offices out there, and many of them are involved in the local market shaping initiatives. So if you're not involved today, one entry point is UNICEF, to make sure that you find the place to go to. But I'm sure, Dr. Kagomba, that you have other responses to that as well. When I have the floor, I want to stress the fact that what we talk about today is about challenges because of COVID-19. They are not new challenges. So what I hope we can see is that we learn from what actually worked better thanks to collaboration in a more systematic way. And trade facilitation is going to be key going forward. And it's very much about building local markets as well. So over to my colleague.
Yeah, thank you very much. So one point that we've seen here at the WTO is that diversification of manufacturing sites is an important aspect in fighting the pandemic. But for diversification to succeed, you also need to make sure that you have your trade measures in place, because it's hard to think that one country, even one region in the world, can have the full ecosystem of everything, for instance, that is involved in a production of a vaccine. Exactly. One thing that we have identified here at the WTO and working with the companies again is that there are over 80 inputs that go into the production of a vaccine. And so this means it's a complex value chains. So you need to make sure that all your trade facilitation measures are in place, not only for finished vaccines to come to your country, but also for the inputs to be able to move from one country to another. And then for things like vials, for example, that are absolutely critical, of course, for the manufacturing of the vaccines. So let me turn it over to Philip, please, to come in with a few comments on this, on the importance of trade facilitation. And of course, your global alliance based on the World Economic Forum is very well positioned to talk about the importance of trade facilitation. So Philip, please, can I ask you to come in?
Yeah, thanks, Annabelle. Sorry. And just coming back to the main question about WTO membership. So the alliance is, a mechanism that has been established specifically to support WTO members, developing and least developed countries within the framework of the Trade Facilitation Agreement. And indeed, it is spearheaded by the World Economic Forum, but also the International Chamber of Commerce and the Center for International Private Enterprise. So in that sense, that is our main focus in terms of partner countries that we work with. Having said that, I think there's one aspect here which we tend to forget within the international trade environment, and that is we have got, all of us, one great benefit is that trade processes are generally reasonably standardized. I mean, a customs administration will work, reasonably in a similar way from one country to another, and the processes in themselves are not extremely complex. The complexity comes from the orchestration of those processes to make sure that things happen at a certain time and work together in order to be able to get a container or a shipment out of a port and airport. And that is where we need to focus. And so to come back to the question, I think countries that are not necessarily WTO members can benefit from the work that is being done within the framework of the Trade Facilitation Agreement, because there's a lot of learnings that are available to everybody, and best practice can easily be replicated if there is political will and commitment to do so. So in that sense, I think coming back to the question, there is a lot of benefits that can come from a lot of the trade facilitation initiatives that are taking place in different parts of the world.
Thank you very much, Philip. So one interesting point that I would maybe like to highlight is that while trade overall, trading goods declined last year about 5.8%, trade in health products increased by 16%, which I think shows the importance of these goods moving from one place to another in an expedited way to be able to save lives. So this is really something that is very, very critical that we're talking about here. So one interesting point that I heard from you, Henari, is that you needed to keep cargo moving. You said this was absolutely critical. After protecting people, you needed to make sure that cargo would move. So what measures did you have to take to make sure that this actually happened?
There were several measures that we had to take. First of all, it was extremely close collaboration with all our stakeholders and partners, from the airlines to the ocean carriers, especially our customers. It was advanced planning with their supply chains, understanding on-the-ground movements, and creating, as I mentioned, that level of visibility within the global network. It was creating that level of visibility and giving the world, it was open to the world, giving them access in order to work very closely and intimately to plan with them. I think that was an extremely critical feature. The second feature is, at Agility, we cater and we believe in the power of the SMEs and how they are a sort of I'll call them a marginalized community when it comes to cross-border trade, even though they make up from the largest numbers of registered businesses, employ close to 50 to 70% of the population. They only take up around 15% of global cross-border trade. What we also did there is we gave access to our digital logistics platform and the visibility in order to secure space for them, secure rates for them, and allow them to continue to trade globally in such a difficult environment.
Thank you very much. Very, very interesting. Dr. Gacombe, let me now come to you because you mentioned the importance of digitization. And may I ask you to expand a little bit more from your experience in Kenya? Why is this so relevant?
It's very relevant from the micro to the macro. For example, at the current time, we have vaccines in the country, and we have places that have demand, but the vaccines aren't there. So one of the things we are advocating is that the platform the government is using to record vaccinations actually has a booking feature, so that those who want to be vaccinated can book and will therefore know where vaccines are needed and direct them there instead of sending them to places and they either expire or they have to be moved to other places. And one of the things that we also realized in actual service delivery is that people were dying looking for ICU beds, but the hospital down the road had a free ICU bed or had surplus oxygen. So we are building platform. We built an app with the help of the Clinton Foundation to show where the ICU beds are, where the vents are, where the oxygen is, because that information asymmetry is what digitization solves by giving feasibility and transparency so that you can match demand and supply. And that applies to just about everything else that we need, whether it's coming out of country or it's in country or it's even within a facility. The lack of transparency and visibility has meant either you pay a very heavy price or you do not have the item at all because you don't know where to get it. So for me, digitizing means that we have global visibility of where things are and where they are needed, and the trade experts can help us to move them from point A to point B.
I think that's a very interesting point that you're making, the need for transparency along the supply chain. And this is something that is valuable, certainly at the country level, but also across countries. And that is, again, one of the topics that we are discussing here at the WTO, which is how to bring about greater transparency, how to go about monitoring of cross-border supply chains in this sector to make sure that we are better prepared for future pandemics. And there's an interesting idea that is being explored, including, for instance, by the International Chamber of Commerce, to establish some kind of coordinated monitoring mechanism at the global level that can actually look into these issues. Because as you were saying, a lot of the concern, which is what we saw at the beginning of the pandemic with the personal protective equipment, is the lack of, the gap in information, and this disconnection between supply and demand, and this gap, the information asymmetry, leads then to panic, leads then, to, in some case, loss of lives, simply because the information was not there on time. So this is clearly a critical issue. I also wanted to ask you, now that I have you on the screen, Dr. Gacombe, can you please share with us some of the practical examples of the regulatory problems that you encountered on the ground?
The first challenge was testing, because before the vaccines came, the protection was PPE, the social distancing and the masks, and of course knowing who is infected so that they can be isolated, so that they are not a risk to others. And that meant we needed to have the kits and the equipment. And our process of approval is, they have to visit the country where the product is coming from, check the factory, the usual non-emergency way of approving products. And the private sector had to get into very serious discussions with the government to say, if this is approved by the FDA or the European Union, let's take our chances with it. We're better off that way than dying for lack of something that's available and in use in other countries. And the same also applies to vaccines. Fortunately, by the time the vaccines were coming, that problem wasn't there. I've not had to go and lobby anyone about us being able to vaccinate. So the vaccines have been a lot easier. But initially, the equipment and the repurposing of medication was a major challenge, and we had to engage the Pharmacy and Poisons Board to fast track the processes. And even the multi-agency approval, you have like 3 parties that have to approve the same product in country. We had to persuade them to have a one-stop shop so that importers are not walking from one government to the next one, and basically wasting a lot of time to get something into the country when it was needed yesterday. So vaccines, PPEs, all medical commodities generally require approval. So we had to create an emergency approval process to fast track. But coupled with that was the need for post-market surveillance. So we are working on improving post-market surveillance, because if you allow things in without spending too much time checking, then it makes sense to make sure that you are tracking them very closely post introduction into the market. And again, we are looking at digital solutions for tracking vaccine side effects, medication side effects, response, the impact of vaccination, because digital tools can make it a lot easier to report failures and concerns and problems.
Excellent. Thank you. Thank you very much. Philip, let me now ask you, what are some of the most important bottlenecks that you working within the context of the Global Alliance for Trade Facilitation have been able to remove in the context of the pandemic?
So there are a number of areas here which we can look at. I think, you know, one area which is critical, which has been an issue, is the process of inspection of goods from customs, but also other government agencies that want to see the goods, because we mustn't forget that, you know, within the context of the pandemic, a lot of processes have been removed, and let's say a lot of shortcuts have been brought. But especially within the context of healthcare, you still got to think about consumer protection, because whilst these shortcuts are effective in the short term, they cannot be an answer for the long term. So you need to establish mechanisms to ensure that you reduce inspections as much as possible, because they are inherently expensive and time consuming, yet ensure that you're not taking a risk with regards to consumer protection. And that balance is very difficult to achieve. So we have spent quite a lot of time looking at risk management in a number of countries. How can we establish a risk management process that is robust and effective? We hear a lot about, you know, all these new technologies, you know, artificial intelligence, blockchain, etc. They're great, but we have to make sure that they work. And in a lot of countries where we operate, which are developing countries, you don't necessarily need to bring in such sophisticated, at this stage, solutions to be able to make a big difference. We really look at you know, the 80-20 rule, right? 20% of the effort gets us 80% of the result. And I think that is the mindset that we are operating in. So perhaps, you know, getting risk management working properly in many countries it can bring great benefit. And of course, the other aspect is, you know, how can we move manual paperwork to electronic paperwork? And here as well, there's a lot that can be done. I'm always amazed, in fact, how far back we are, or how non-advanced we are in this domain generally, because there are all these technologies out there, yet so many processes are still manual. And I think there's a lot of work. We could have a whole panel discussion on that, but a lot of work still needs to be done. And our approach is really to work from bottom up. So rather to try and attempt to, let's say, boil the ocean, is try and identify what are the blockages on the ground, work step by step, digitalize those, and then try and generate a momentum which will go exponential.
Thank you very much. Unfortunately, we're coming to the end of our panel, which I have found fascinating. Let me just give the floor to each of you for 1 minute for a very quick final reflection, and maybe I'll follow our initial orders. Charlotte, over to you. 1 minute.
Thank you very much. I think what we want to take away from this session is that we need to work together, and we need to facilitate the supply chain and learn from what we have experienced. Digitalization is super important, but it's not only about digitalization, it's about changing behavior to use the systems. And I do think that is something we need to come together around. And finally, you know what, in the development world, we also compete when we should collaborate. And we put 10 brands out there, and, you know, visibility is important. That has to be tackled. And these are kind of elephants in the room that I want to continue to discuss. Thank you for the opportunity.
Thank you. Thank you very much. Philip?
Well, from my end, I think, we've all gone through a traumatic experience around the world. Let's try and see whether there is some good that can come out of this. And, let's not forget to write down the learnings of what we have experienced and perhaps use the momentum that has been created, to come back to Charlotte's point, for collaboration, to try and see whether there is anything that we can pull out of this which is going to make a positive difference in terms of facilitating trade. So I think, in a way, it's an exciting time, because I think this pandemic has awoken a lot of people, has created a lot of a thought process with regards to how we can improve the way we move goods around the world. And it'll be interesting to see, 3 or 5 years time down the line, how this pandemic will have affected supply chains.
Thank you. Thank you very much, Philip. Henari?
I'd actually strongly agree with Charlotte and Philip, and like to actually build on it. I think these times are unprecedented. And what we've seen is the collaboration between the public and private sector coming together and driving and making waves for good. Not that we haven't solved all the problems, but we've taken leaps and strides to tackle issues, and we're getting there. And leveraging innovation and technology from both sides can really draw and bring answers and solutions to everyone.
Thank you. Thank you very much. Dr. Gacombe?
Thank you. From where I see it, the biggest lesson has been that global problems require global solutions. And there is no country, especially where healthcare is concerned, that can cope with a pandemic all on its own. And it doesn't matter which country. We all need each other to help to respond. And it is not just a government response, it has to be an all of country response as we try to mount here, so that everybody who has a contribution to make can be given an opportunity to bring it to the table and use it for the good of the people of the country and the world.
Thank you. Thank you very much. I have to say that the four of you have made my life easier now that I have to come up and sum up our conversation. And I have really 3 key takeaways, which build on everything that you've said. The first one is the role of collaboration. It is cooperation across countries and within countries. And Dr. Kagombe, I think, put it very, very clearly. The second point, I think, is this relentless focus on facilitation and bottleneck removal. Fast track, hand in hand with robust and effective post-market surveillance and risk management. But this focus, unrelentless focus on trade facilitation, is key. And the third element that I want to bring in is the role of innovation, technology, and digitalization in helping us move in this direction. So with those final words, let me thank each and every one of you, Charlotte, Henari, Dr. Gacombe, and Philip, for a fantastic panel. And thank you very much to our audience also for joining us in this conversation. Thank you.
Thank you.
Thank you.
Yeah.